Hi, my name is Abigail Versemann, and I'm a reproductive specialist working in a public health clinic. The city in which I work is populated with a lot of college students and young families. Many of the patients I see are young couples expecting their first child, couples trying to get pregnant, and young adults with other reproductive disorders. The disorder I'm addressing today is endometriosis. I see this disorder fairly often since 11% of American women between the ages of 15 and 44 are affected by it. In the past year, out of 1,000 patients, I have seen 110 women with this disorder. The most common symptom of this disorder is various types of pain, including intense menstrual cramps, lower back and pelvic pain, pain during sex, intestinal pain, or pain during bowel movements or urination. Other symptoms include bleeding between menstrual cycles, infertility, and digestive problems. The first treatment I typically recommend is medication, either birth control for women who are not trying to get pregnant, or a gonadotropin-releasing hormone agonist for women who are trying to get pregnant. Depending on the medication used, this treatment can last up to 7 years or for as long as the medication is taken. However, if pain or other symptoms are severe or do not subside with medication, I refer my patients to a surgeon. The patient I am currently seeing with this disorder is a 21-year-old female and has been having symptoms for the last 3 years. She is a middle-class Caucasian. She reported that she has had an irregular menstrual cycle since it began at age 14. She also had an appendectomy at age 15. I have been seeing this patient for the last 3 years when her symptoms began. I initially recommended an intrauterine device to help regulate her periods and hopefully reduce some of her menstrual pain. Her pain subsided for a few months, but then returned about 3 months after its insertion, along with her irregular cycle. She had one surgery to remove the endometriosis by debridement, but the disorder came right back. Thus, I am now recommending her to a different surgeon whose method attacks the endometriosis at its root. Endometriosis is common enough that it would be beneficial for young women to be aware of it. The disease cannot be prevented, although one can reduce your chances of developing it by practicing habits that control estrogen levels, since high estrogen levels are associated with the disease. These practices include regular exercise and avoiding excessive amounts of alcohol and caffeine. I think the most important thing to remember with patients who have endometriosis is that this is a debilitating disorder, not only in that they have a difficult time getting pregnant, but that the pain is severe and can affect them every minute of every day. It is also possible that the endometriosis can come back even after surgery, and thus it must be closely monitored. This recurrence is a major problem with the disorder. If I have to send a patient into surgery, it would be preferable that only one surgery is necessary to eliminate the problem. Surgical procedures ought to be improved with this goal in mind.